Hello, everybody. Welcome to the SASW Conference 2022. We're just going to wait for a minute or so to make sure that everybody who's coming to the session can get in. You just give us a minute. But then we'll make a fairly snappy start. We're asking people to mute their microphones, unless they're speaking, of course, but really happy to have cameras on. It's great for our speakers to be able to get a sense of the people that they're speaking to, and hopefully we'll generate some conversation later on in the morning. Okay, shall we make a start? So, welcome everybody to the Scottish Association for Social Work's Conference 2022. The right time, relationships and equality in challenging times. So we've got sessions today and tomorrow. We very much hope that you'll enjoy and find things that will enthuse, invigorate, and remind you that social work is a thriving and an influential community. This session's been recorded and we will send out the slides in the next few days. It's not been an easy 3 years, has it? And even though most of us are now able to socialise and travel, these are still really challenging times. In the aftermath, well, or is it after, of the pandemic, the world, Scotland and social work have urgent and huge agendas to address. Climate change, the war in Ukraine, energy prices, cost of living, poverty, how to provide better health and care services. Within this, I noticed there's a lot of use of the words human rights across our policy environment and in our work at the moment. What does it mean? Do we all mean the same thing? Often, I think we mean something about fairness and ensuring that individuals and communities can achieve decent lives and that we will have some safety net should the worst happen. You'll be really glad I'm not going to give a philosophy lecture, but recently I've come across Richard Rorty, who was writing actually after I finished my philosophy course many years ago. He's an American philosopher who died just in 2007. But Rorty contends that throughout history humans have devised various means of construing certain groups of individuals. Sorry, could somebody mute? There's a bit of an echo. Thank you. So, Rorty contends that throughout history, humans have devised various means of construing certain groups of individuals as inhuman or subhuman, thereby deciding basically on who and who doesn't have human rights. He says that no amount of rationalism, and for that I read into legislation, logical argument, policy, guidance, all of these things, none of that will resolve the violence and degradation that happens when we decide that a group of people are somehow not as fully human as we are. He says what we have to do is create a culture of global human rights by teaching and learning empathy and understanding the circumstances and the suffering of others from our earliest years. And this means through experiences at home, through education, through further education, and so on. And actually, I think fundamentally this means being a caring and an empathic society. Back to the conference. When we at SASW begin to plan our conferences, we usually set up a short life working group with some of our committee members and we plan it together. For this conference, we listed some areas that we know social workers want to think about at the moment. So following the lockdowns of the pandemic, we wanted to recognise the importance of opportunities for friendships and for intimate relationships in our lives. We agreed we haven't solved our problems around drug deaths in Scotland. But what does human rights actually mean for people who are seen as breaking the law and sometimes seen as the most undeserving of support? When we have a cost of living crisis as we do now, what does this mean for people in need of support who are often already traumatised and in poverty? How are their human rights articulated and meaningfully addressed, and by whom? We also wanted to keep some of the topics in the conference, such as working conditions for social workers and anti-racism, because you keep telling us that we need to keep these things high on the agenda. So they're part of this conference too, over the 2 days. So you can see why we chose the title today, The Right Time, Relationships and Equality in Challenging Times. So this conference offers a range of opportunities to think about what human rights means in our practice and our policy worlds. about the rights of people who need support and the rights of workers, about who holds rights, who has duties to deliver on those rights, and the consequences when we don't. Lastly, slight apologies from us. Our conference this year is later in the year than usual. We had changed in the staff team over summer and felt we should wait a couple of months to ensure you have the best experience. There will be feedback forms at the end of the conference. We'll listen to your feedback and make sure that we try to get the best timing and future content for you. A couple of things just before I finish and introduce our first speaker. Please tweet during the conference sessions today and tomorrow. Our hashtag is SASW Conf22 and our handles are in the programme. Thank you to the Scottish Social Services Council, our sponsor for this conference. Your support is vital to the health of social work in Scotland. We'll have several opportunities for you to ask questions this morning. So after Jeremy Balfour and then after the Minister, Kevin Stewart, after he speaks. And then there will be a few more speakers and then another 10-minute opportunity to ask speakers questions at the end of today's session. So please put your questions into the chat as soon as possible, especially those for Jeremy and for Mr. Stewart. I'll do my best to get as many answers as we've got time for. So first, let's go to Jeremy Balfour, MSP, on his hopes for how the bill to introduce Scotland's first Disability Commissioner will advance the rights of people with disability. Jeremy.
Alison, thank you very much for your welcome and good afternoon, everybody. Thank you for the invitation just to talk a wee bit about my proposal for a Commissioner for Disability. Maybe just before I jump into that, just a little bit about my background. I have been in MSP for 6 years, and before that had lots of different types of jobs, but in particular, I was a local councillor for a number of years before coming into Parliament. I was born with a physical disability, with no left arm and just with 2 fingers on a shortened right arm. So I have benefited immensely from social workers and other care providers throughout my life. When I came into Parliament 6 years ago, if you'd asked me what one issue will you be campaigning most on, I don't think it would have been disability, in all honesty. I was in many ways had very little contact with the disability community throughout my life. I went to a mainstream school, university and work, and by chance didn't have that many people who had a disability in their life. But as I arrived in the Parliament just over 6 years ago, I was at that point the only member, the only MSP who had a physical disability. And perhaps inevitably, charities, organisations came to me and I had the opportunity to talk to them. Fast forwarding, we obviously entered into the period of COVID and the consequences of that, many of us are still living with. And last year, when I got re-elected, it seemed to me that the voice of disability had been more affected by COVID than any of the other perhaps protected characteristics. I say slightly controversially, and I would be interested at some point to get people's feedback. For me, where we are in regard to the disability movement is where women's rights were back in the maybe late 50s, early 60s. They're starting to be on the agenda, but they're not being taken forward particularly fast, and we have a long way to go. I think if that was true before COVID, it's certainly true after COVID. And so, along with discussions with different individuals and groups, it seemed to me the appropriate way forward was to have a Commissioner for Disability to cover all disability, both physical and hidden, learning difficulties, and other areas as well. And for that Commissioner to be predominantly are a champion for those with disability. I think many people who have disability, many people whose families have disability or working with disability, the energy of getting out of bed in the morning, of getting yourself washed and dressed, can actually take up all the resources that many of us have. The thought of having to run campaigns, to speak to politicians, to lobby civic society is just a step too far for many individuals. And it came clear to me that we need that champion who can speak to health boards, to speak to COSLA local authorities, who can speak to government, who can speak into situations in the media, who can advocate on behalf of those who have a disability. As well as that, there are areas where we need to challenge. Through my casework, I know that many of the services that we benefited from before COVID have not been restored fully due to staffing issues, financial, but actually maybe fundamentally, people simply just forget and don't do. So that is areas that the Disability Commissioner could cover. There will be other areas that perhaps, again, you would like to feed into it. So over the summer, I carried out a consultation on the general principles of having a commissioner for disability. And I'm pleased to report that we had a really good response with hundreds of people and organisations and charities responding. I have spent since the middle of August looking at those responses, reading them, finding some really interesting comments and reviewing the situation. Out of that, I have decided that I am going to take forward my proposal. And the next step for that is that probably in 2 weeks' time, I will launch a formal proposal to the Scottish Parliament. That proposal requires 18 MSPs from at least 2 political parties to sign, and I have a 4-week period, a 4-week window for that to run. It's also an opportunity for the Scottish Government to comment on my proposals and to give their feedback on where they think the proposed bill would be. If I get those signatures and if the Scottish Government don't decide to take over the bill, then sometime next year, hopefully towards late spring, early summer, I will introduce a formal bill into the Parliament. What has been really interesting for me, and I think one of the issues that many people are grasped with, is how can one individual, one organisation cover all disability? But what has become interesting from my perspective, as I have looked at the answers back, is that actually many of the issues that people face is not dependent on their disability. It is actually just where things are. So whether that is social care, whether that is education, whether that is transport, whether you have a learning difficulty or a physical disability or a hidden disability, the issues may manifest themselves in a slightly different way, but actually the issues are key. And without prescribing how a commissioner would go about, because clearly that will be for him or her to decide, I think it will be much more issue-based rather than disability-based. And there are some key challenges around that, as I've said. I think we have to try to move things forward in regard to employment, in regard to unpaid care, in regard to provision between education and college, and between what health services we can expect to get. Let me be absolutely clear. The Commissioner will not solve all our problems overnight. This is not a magic wand that will suddenly make everything better. But I think it will get onto the agenda many issues that we do face, and will at least give that movement forward, which I think disability issues desperately need. This is a journey that we're going on, and it's part of the journey. Perhaps I can just address some concerns that have been raised with me. I'm not saying I have all the answers, and as I say, this is a conversation that doesn't simply stop when I lodge my application. Very much so, it is a continued conversation. I have reached out deliberately to as many charities, individuals as I know. Clearly, I will not have covered everybody, and it's not too late to give your views to me informally. I'm sure Alison will put my email address in the chat box at some point, and please do come with questions that you have, because if I take the bill forward, the drafting of the bill will be key, and I need as much input from as many individuals as is possible. I know there is a concern that some disabilities will be left behind, particularly the disabilities where people find it more difficult than others to advocate, whether that is learning difficulties, whether that is some of the hidden disabilities, or actually whether that is people that have got disability that live in perhaps not central Scotland. I am very conscious of that, very aware of that, and so it is my intention to make sure that however we set up this organisation, if we set it up, then it will have an absolute open door to everybody and everyone. It is not going to be whoever shouts loudest gets heard. It will be an open organisation that will take on board everyone's experience and everyone's issues. As I said previously, I think actually the way to do this would not be to say, you know, Monday morning I'm looking at physical disability, Wednesday afternoon it's hidden disability. I think that won't work. But what I think will work to say is what are the key issues that people are facing, and let's take those forward. That will mean being out and about. If this organisation simply sits in an office in Edinburgh, Glasgow, wherever it is positioned, and waits for people to come to them, it will have failed. What we need is an individual group of individuals who go out and listen to people. That means it's not there to replace the brilliant third sector that we have already. It's not there to suddenly say we don't need charities and individuals doing stuff. It works together in partnership with these organisations. It needs to speak to key stakeholders to make sure that they are in line with some of the issues. And I think a really good example of that is the Children's Commissioner. He, over the last 3 years, has gone out, listened to children, listened to kids, and really engaged before taking forward policies and issues. One of the other comments I get back is, well, you know, we've already got a Children's Commissioner, we've already got ECHR Commissioner, we've got a Commissioner for this, a Commissioner for that. Do we need another Commissioner? And the simple answer to that is yes, we do. And the reason I say that is that, yes, there are lots of people doing a lot of good work. But if you analyse where disability falls within that, often there are very few of these organisations taking forward specific disabled issues. So there's plenty of work out there for everybody. We don't need to be precious about some of the issues that we're dealing with. We need cooperation and partnership. But I'm very conscious that there is lots of stuff out there to be done around specific disability issues. I'm going to conclude in a couple of moments to leave us just some time for any questions or comments. But I do hope that this will be a light, a beacon, a voice, whichever word you prefer, who can start advocating on behalf of disability. We need that. We need our politicians to be listening. We need government to be listening. and I need you to be playing your part in helping you do that. So I really thank Alison and her colleagues for allowing me these few minutes to share what I have done, where I think it might go. But please do join me on this. You are the experts, and what we need is experts making this work. And then hopefully it's the next step forward in our campaign for equality, real equality here in Scotland for those of us with disability. So Alison, I will do what most politicians don't do. I will stop quicker than I probably should have, but I'm really, really happy to take questions, comments, and if I don't know the answer, I will try to admit that, and I will come back and answer it through Alison. So over back to you, Alison.
Thank you so much, Jeremy. And I guess that there were lots of things that struck me in what you said, and I think it's really helpful to have the kind of the story of how this idea has developed and the timescale for where it's going over the next wee while, you know, in the next month and beyond and into next summer. I mean, and you've talked about this feeling like it's still an early stage in disability rights. I was wondering whether any of the audience would like to come in and talk about any other hopes that they might have for a disability commissioner, a commissioner for people with disability. You can either come in the chat if you'd like to raise your hand and say something. Please do that. Because I was interested about the thematic approach, Jeremy, you know, and that they seem really quite concrete themes in terms of what we think of as a dignified and meaningful life. You know, employment, how we get our care, both from formal means and informal means, paid and unpaid care, how we develop from young people into adults and beyond, and then health services, and how we keep well. I can see that there's a question from Stephen Tate from Get Together in the chat. Stephen, would you like to actually come in and unmute yourself and ask your question directly? Hi, Stephen. Sorry, I can't hear you. I think we might have to unmute you from the back. Sarah Jackson, are you on that?
You shouldn't be muted.
Okay, oh, there we can see it working now, Stephen. Oh, so sorry, Stephen. We can see that your microphone seems to be on, but we can't hear you. If it's okay, I'll ask the question that you've kindly put in the chat, which is, so what Stephen asks, Jeremy, is, do you think the new disability commissioner should be someone with lived experience with a disability?
Thank you for your question, Stephen. I deliberately didn't address that in my speech because it is perhaps one of the more interesting topics to discuss. I really want to hear from people around this particular area. I'm always wary about limiting people who can apply for jobs. You know, so I think I would not want to say you definitely have to have a disability yourself. I think you need to have experience of disability, and I think you need to know where the disability issues are in regard to that. So I probably, if I was being pushed today, I would say no, but I am open to that suggestion, and I think it's a really key issue that we get somebody who understands the issues. And I think, you know, picking up Alison's point, one of the things that people often come back and say is, well, there's lots of legislation out there already. Let's just add more legislation. Now, there's lots of legislation out there. Actually, I think we, you know, one of the best examples of that is self-directed payments. You know, I wasn't in the Parliament, so I can claim no credit for this, but I actually think it was one of the best pieces of legislation the Parliament has passed. It's really good. But go out to the 32 local authorities and you will get such a variation in practice from one local authority. Often next door local authorities are handling it in completely different ways. So we don't need more legislation around self-directed payments. We just need the legislation to be implemented properly by the local authorities. And that's where I think the Commissioner can step in and do something really helpfully. So it's not saying, we want 20 new laws passed within 2 years of the Commission up and running. I suspect the main role would be to say, here's the law we have. Some of it's actually quite good law, but it's not working in practice for individuals.
Thanks, Jeremy. I think in many of these discussions we come back to, we have sometimes good principles. People fundamentally have human rights. None of the upcoming legislation or policy moves changes anybody's human rights. So again, it's about that gap, isn't there, between what we theoretically think that we are enabling and then what is actually happening to people who need additional support in some way or another. We've got a question here. Anne-Marie asks, how can we reframe disability in a positive light when much of the public and political discourse sees it as negative?
Yeah, I think that's a really good question. I think in some ways, it's very interesting if you listen to some people. The Paralympics are a great thing. I love the Paralympics. I had a great week, whatever it was, 8 years ago, 10 years ago in London watching it. But the danger is, after the Paralympics are on or any power sports on, everybody says, well, look, you're disabled. Why don't you go and run 100 meters in 10 seconds? And there does seem to be an almost link that just because you're disabled, everybody else can do exactly the same. So I think we do need role models. I think it's really important to get role models in regard to that. But we've also got to be realistic. Most of us aren't Olympians. Most of us aren't academic geniuses. Most of us can't do everything that the elite can do. So we have to reconcile that and say, actually, here is somebody who is living their life to the best of their ability, enjoying their life to the best of their ability, because they're getting the support from society to allow them to do that. And that's the model I think we should be aiming at. So we're not asking that we all go to the Paralympics. We're not all asking that we're, chief executive of whichever organisation or whatever. But it's actually saying, what is my potential? What is holding me back from that potential? And what can help me do that in regard to that? So we're not looking for special areas. What we're looking for is the ability to live our lives as everybody else lives their lives. And I think that's the message. I think there is a movement there. I think politicians are starting to listen to that. I think society is starting to listen to that. But I think we have a long way still to go on it. And I think until we can actually say, this is what we want, and this is how we get it, and it will be different for each disability, then we've still got that journey to go. But I think we need to be, I think we as the disability community, if I can use it in that kind of very broad way, need to be absolutely clear what we want from civic society and what we want from our politicians. And sometimes that's a bit unclear. And, so I think that would be another role for the commissioners to go around, taking that evidence and then, taking that forward. And that would be a really good question, he says, landing a minute, for the minister who's coming up in 1 minute's time. Ask him that question and see what answer you get, because I'd be very interested to see what he has to say. And I think he will have a lot of good stuff to say. But, that would be a good question to ask him.
Right, thank you. I can see we've got a question. I'm afraid that your name in the chat is Droopy Draws 49. Can we have, this will be the last question for Jeremy, and then we'll have to get on with our next speaker, but please unmute yourself.
It ought to say Linda Riley. That was a nickname at work a long time ago. What I wanted to ask was, at the moment we have this awful problem of bed blocking, and this is partly because it appears that social services are not able for some reason to work together with the NHS. This is an ongoing problem, and I'm wondering if with all this idea of somebody, I would say in a very prominent position as advocate, would there in all of this and all of the idea of bringing out legislation and or improving it, would there then be a possibility that this would influence the problems that we've got? For instance, if somebody is going to need support when they get home, will there be a difference in the way that this is worked out, rather than having people who are able to go home but don't have anything in place? Because this is something that I feel is really needed.
Thank you.
Yeah, I mean, that's a really important question, which we could spend the rest of the conference today and tomorrow discussing. And again, I would suggest you put the question to the Minister as well, because that's one of his areas that he covers. One of the big problems we have, and forget politics of all, but one of the big problems we have is bed blocking. And we've had that for years. It's not a new issue. It's an issue that we all face. And what we need to do is make sure that social care is properly funded and respected. That means paying people an appropriate wage. It means having proper employment rights. But one of the big problems we have is people go back into our communities and we don't have that care. And I really hope that the Disability Commissioner would be able to pick that one up and run with that. I hope we don't have to wait that long either. I mean, I think actually we do need to reach out cross-party on this one and say, how do we solve this issue? Because it is a massive issue for all of us to face. But yes, I do hope it will be addressed, and I think we need to look for solutions that will work for people within their local area. So that doesn't mean one size fits all. It will be working out for each individual. But it's a key issue. We are getting an older society. We're going to have more of these issues facing us. We do need to face that. I will stop there. I also have to apologise that I can't stay for your rest of the conference because unfortunately I have to be in the chamber in a few minutes' time. But I wish you well. Please do come back to me if you've got other comments, questions, and I really hope the rest of your conference goes really well. Thank you.
Thank you very much, Jeremy. Cheerio. And that's a fantastic segue, actually, into our ministerial address from the Minister for Mental Health and Social Care, Mr. Kevin Stewart, MSP. Welcome.
Thank you, Alison. Do you just want me to go ahead? Yeah. Well, thank you for that very brief introduction, Alison. And I'd like to take a few moments to, first of all, recognise the incredible resilience that social workers have shown, especially over the last few years. Since 2019, we have all faced COVID-19. We're all having to respond to the war in Ukraine. The cost of living crisis is up there too, and we're all coping as well with an evolving policy landscape. And I'm acutely aware of the pressures facing social workers, including issues related to capacity due to increasing complexity of caseloads. But throughout all of this, you have supported individuals, families and communities. And on behalf of the people of Scotland, I offer you all my most heartfelt thanks for all of your efforts. I was fortunate to be at the Scottish Social Services Awards a few weeks ago, and I even got a cuddle from Alison at that as well, which was welcome. And we celebrated there the success of the sector. And particularly, I enjoyed seeing the Scottish Association of Social Work present the award for the Social Worker of the Year. And I'm delighted to have been invited here to speak about the National Care Service with the overarching theme of the conference on relationships and equality in challenging times. And this is a welcome opportunity to talk about how we will incorporate human rights into the design of the National Care Service, alongside our co-design ambitions and our plans to move forward with creating an actively anti-racist culture in social work. So what do I mean by incorporating human rights into the National Care Service? A cornerstone of social work and social care support is ensuring that people who use these services are respected, empowered, and have the freedom of choice. Our ambition for the National Care Service is to establish a social care system that empowers people to thrive, not one that just enables people to survive. The need for a person-centred approach for all those seeking care and support from the NCS is a core principle of our work. We have enshrined in the Bill's principles our commitment to ensuring that the National Care Service, as well as those providing services on its behalf, communicates with people in an inclusive way. Before the NCS Bill was introduced in June of this year, the independent review of adult social care took place. And during this process, Scottish Government met, consulted and engaged with people who use services, their carers, the workforce and our key partners and stakeholders. And the aim of the National Care Service is to ensure consistent, fair and high quality care for everyone in Scotland, reducing the current variations that exist across our country. The National Care Service is not about nationalising services. The bill sets out that functions are focused on consistency through national oversight. Services will continue to be designed and delivered locally. That is the right approach to support delivery that is with and for our communities and the people within them. These changes will bring forward new power sharing arrangements at a national and local level and clarity for people about ultimate accountability. Ministers will be accountable for the National Care Service. And we are deeply committed to ensuring that the National Care Service has a human rights-based approach. The NCS will respect, protect and fulfil the human rights of people accessing care support, and also the same applies to their carers. The NCS Bill's principles clearly state that the government recognises social work, social care and community health services as essential to the realisation of fundamental human rights, and that these services will have equality, non-discrimination and the dignity of the individual at their heart. Equality, dignity and human rights will be the threads which weave the National Care Service together. These themes are certainly not new to social work. Indeed, they're reflected in many pieces of the very complex legislative framework within which you work, going right back to the 1968 Social Work Act. And we are committed to empowering people across Scotland to make the choices that are right for them. And in order to achieve this, the National Care Service will be designed together with carers and the people who access and deliver social work and social care support. We're co-designing the National Care Service and we will continue to listen, to work with registered social workers, the Scottish Association of Social Work, Social Work Scotland and other partners to to progress this opportunity to deliver public service improvement. Excuse me. This is an opportunity for social work to be at the forefront of policy development and improvement. It's also an opportunity to include people across society in a conversation about their needs, to ensure that we are getting it right for everyone, for service users and workers in this sector. This is the right approach. And we are committed to have an ongoing and open dialogue to support this transformation. To ensure that this change happens the right way, we will all need to challenge and be challenged. And the social work profession plays a key role in reducing health inequalities, ensuring public protection, promoting social justice, upholding human rights, and in challenging discrimination. Of course, the social work profession will play a vital role within the National Care Service. Social workers are a highly skilled and valued profession, making a unique contribution to the lives of individuals and families throughout Scotland. The National Care Service is an opportunity to invest in the social work profession through things like education, pre and post qualifying, improving by establishing a centre of excellence and scaling up good practice, by better workforce planning, and by providing a national approach to social work terms and conditions, including pay and grading. All of this will be achieved through the creation of the National Social Work Agency. Our ambition is to raise the status of and ensure investment in the social work profession. And Iona Colvin will speak more about the National Social Work Agency after me, I believe. And as well as investing financially in the social work sector, we need to invest in you. Supporting the well-being of our social work workforce has been increasingly important over the last few years. In 2021, the Scottish Association of Social Workers launched the Social Work Professional Support Service, offering peer-to-peer support for social workers and student social workers, to talk through any issues and to support folks in their careers. And I'm delighted to hear that a massive 93% of users scored the service 4 out of 5 or higher. We also view the Scottish Association of Social Workers independent advisor, who is informing the development of the National Care Service. Another crucial right is the right to live and work in a safe environment, free of harassment and discrimination. Yet in 2022, racism is still a prevalent issue, both in the wider world and within our own sector. In 2021, a Scottish Association of Social Workers report explored the issue of racism in Scottish social work. The report that found that racism exists in social work in Scotland and that it's both harmful to both individuals and the profession. And we all need to address this both individually and collectively. First, we must listen. We must listen to the voices of those who have spoken up about their experiences and make space for others to come forward. And we must act. The responsibility for addressing racism lies with us, all of us. Sector, workplace and political leaders all have a responsibility to promote a culture of inclusivity and diversity. Educators have a responsibility to embed anti-racist and anti-discriminatory practice in their teaching. There is good work underway. The Scottish Association of Social Workers Anti-Racism Advisory Group is taking forward actions from that 2021 report. The Scottish Government's Leading to Change programme, a leadership development programme, along with the workforce, is focusing on anti-racism in health, social work and social care. And together we can and we must build a culture of inclusivity and diversity in Scotland. Before I finish though, I have one ask. I urge you to speak to us, to continue to speak to us. Join in the National Care Service co-design activities, engagements and discussions. Tell us what you want for social work and how you want to shape the future of social work. Once again, Alison, thank you for inviting me today, and now I'm happy to take any questions that folks may have, and may not be the ones that Jeremy told you to ask me.
Thank you very much, Kevin. And just to say, we reminded to people, and Anne-Marie, maybe you can put some information in the chat around the social work policy panel, which is for frontline social workers and is a way of engaging frontline social workers engaging with Scottish Government, Social Work Scotland and SASW on the development of the National Care Service. So we'll put some information up on that. So Kevin, we did have a question from Linda earlier on, who asked, she asked Jeremy because it kind of linked to the kind of the notion of disability rights, but also very much to integrated health and social care services, which was, and Linda, come in and correct me if I've got this wrong, but it's about we know we've got a problem in terms of people not being able to leave hospital in the timescales that we would like, and when people are well enough to. What's kind of your vision for the National Care Service, and how are we going to get there? What kind of the steps by which we're going to get to a situation where that's not the case? Is that fair enough, Linda?
Linda, I'm not going to forget that name, Droopy Drawers 49, Linda. Jeez. Linda, I thought that you were excellent at the National Care Service Forum in terms of your answers, and I hope that my answer is going to be as good today as your answers were at that forum. We have a problem at this moment with delayed discharge. That is a problem that has been exacerbated by COVID and the situation that we find ourselves in. However, it would be fair to say that some areas of the country are coping better than others because of different practice that exists. And I'm going to be a little bit parochial here, if folks don't mind. In my own area in Aberdeen, there is, like everywhere, a difficulty with delayed discharge, but the people that are waiting in Aberdeen are fewer than they are in many other parts of the country. Now, why is that? There are a number of reasons, I think, but one of the main reasons is the fact that the Granite Care Consortium, who deliver care at home, have given much more autonomy to their frontline staff. So frontline staff can take decisions around about whether a person requires care to be stepped up or stepped down. No requirement for a huge amount of assessment. The trust is in the person who is going in and caring for an individual. And they know if somebody is becoming frailer, and they know if somebody is becoming better. And their ability to step up and step down care in consultation with those that are being cared for and their families means that, you know, that halt in terms of frailty can happen. So that means less people going to the hospital in the first place. And the ability to step down, which happens much less, as I'm sure folk understand, also gives the ability to free up time to commit to those folks who are not doing quite so well. Now, at this moment, we're trying to encourage others to follow that kind of practice. And that is happening elsewhere. It's happening in places like Fife too. but it's not happening quickly enough. And this is the right way to go as we move forward. We don't want folk to go into hospital in the first place if it can be helped. And if that means stepping up care to avoid that situation, that's what we should be doing. So much more of that autonomy, much more of that preventative approach, and that will go a long way in helping us reduce the levels of delayed discharge. Now, I noticed some things in chat. I'll be guided by you where you're taking me here, Alison, but there are some interesting points in chat if you want me to follow up on those.
If you've got, have you got a few more minutes? Because I know that you have to rush off at some point. But if you've got, there's 2 points here, which is from Dee. There's about kind of the role of commissioning and how we do commissioning. And can you tell us more about how commissioning will change to deliver better and more flexible services?
I managed to mute myself there, sorry. Dee is absolutely right around about the commissioning being slightly different in terms of the Granite Care Consortium. Absolutely spot on right. But others should be looking in the here and now to adapt to allow these things to happen in the here and now. However, with National Care Service, what we intend to do is to ensure that we have ethical procurement, which puts fair work at its very heart, but also, allows for these flexibilities to improve the quality of care for people. Now, I want folk to become involved in terms of the shaping of that ethical procurement procedures. I know that from my time in local government, which was only 10 years ago, procurement has changed. And many folk tell me it's for the worse in many places. Aberdeen gives us a very good example of how, if we are flexible and we think about people's care needs and think about the staff and their abilities and give them the autonomy and independence, we can provide not only better care for people, but we also can provide a better working environment for staff. And beyond that too, what is happening there, I think, is quite clear, is that there is a saving to the public purse because there's the ability to tackle frailty much, much quicker. And of course, if we're doing that, that also stops the human cost of having folk in crisis and then having to go into hospital. So huge advantages there. Dee, you're right, they have done something differently. There's nothing stopping others from doing that in the here and now, but we will ensure that that is the case through ethical procurement as we move forward. Alison, I've rabbited on, so I'm willing to take a couple more, as long as I'm not eating into Iona's time. Because she might get me tomorrow morning.
I'll leave that between you and Iona.
Yeah.
But I suppose there's a couple of things here. I need to grab the nettle here and kind of talk a little bit about social worker autonomy, because this is something that the profession feels that it really needs.
Yeah.
And you were talking there about the autonomy that has been experienced in one of the kind of social care and commissioning models. But it's about how are we going to get rid of the barriers that stop professionals being autonomous, which seem to be around who makes decisions about resource.
Yeah, I agree. And Alison, as many others in the room do, that have talked to a fair amount of frontline social workers in my time in this job. It has been much better in the past few months because I've been able to go out and about and talk to folks in their own environments, and they're often much more willing to say it like it is in those environments. And many people, the vast bulk of folk, feel that they do not have the independence and autonomy that they should have in order to fulfill their role. And the main issues that come up around about that are eligibility criteria, which many folk do not think are flexible and are not helpful in terms of prevention. And of course, who holds the budget purse strings? And I think, you know, and I've said this previously, again, from my time in local government, you know, the chief social worker was normally a senior official at the table when it came to budget discussions. And I know in many places that that's not the case anymore. And we have to work through that. The other aspect of this is that there seems to be a lack of flexibility in terms of shifting resource to preventative care rather than crisis. And I think that that is likely costing us a huge amount of money, and it would be very much worthwhile turning all of that on its head. So I think, you know, we have to look at eligibility criteria and eradicating a lot of the bureaucracies around about that. And we have to look at who holds the budget purse strings. And in so doing, we must ensure that those folks in the front line have the autonomy and flexibility to do the job that they came into social work to do. Now, one of the things is I'm going to Fife in the very near future to look at some work that they have been doing there, which have basically, I don't want to say a complete blank sheet, but it's given social workers there near enough a blank sheet in order to do their jobs there. And by the signs of it, the outcomes are very, very good. So that is something that we may need to replicate a lot more.
Thank you. One more question from Stephen Tate here, which is, will people with lived experience of disability have the chance to be represented on the National Care Service?
I want people with lived experience to be involved in every aspect of this, Stephen. The lived experience expert panels will help us shape the National Care Service along with stakeholders. Your voice is immensely important, I think, in terms of helping us plug the implementation gaps that currently exist. But beyond that, you know, I've not talked a huge amount about local care boards and who should be on them, because I think that's part of the co-design process. But the one thing that I am absolutely adamant on, Stephen, is that the voices of lived experience should be on local care boards with a vote. You're vital.
Thank you. Hopefully that answers the question there for Stephen. I think we're going to have to move on. Kevin,
Well, thank you for giving me the opportunity, Alison.
Thank you very much for coming. I can see that there's some questions about workforce that are coming in the chat, but we have Iona next, so we'll.
So one of the things is, I'm sure Iona will answer many of those questions, but if there's anything that comes in chat that's directed towards me that Iona doesn't manage to cover, then please capture the questions, send them to me, and I will respond accordingly, Alison. Thank you.
Thank you very much, and we know that you do that for us. Thank you very much. Thank you for coming.
Cheers, everyone. Thank you. Bye-bye.
Cheerio. And so, Iona, welcome, Iona. So Iona is Chief Social Work Advisor at Scottish Government. And I think today, Iona, you're going to give us an overview about some of the current challenges and about the National Social Work Agency proposal.
Yes.
Over to you.
Thank you. I need to follow Mr. Stewart and answer all those questions, so we'll see how we do. Thanks very much. It's really nice to be here, conference, to speak to everybody. And as Mr. Stewart has said, I think it's really important that you make your voice heard and that you ask the questions and you participate as much as possible to shape both the National Care Service and the National Social Work Agency. So if I could move on to the next slide. I guess this is one of the questions that we are my team, which is the Office of the Chief Social Work Advisor team, and SASW and Social Work Scotland are working together on the proposals around the National Social Work Agency. And really, at the moment, what we've got is a steering group between the three agencies, trying to shape up what we need to do so that we can come and talk to everybody about it and consult on it. So this is a bit of a forerunner of that. And as Mr. Stewart has said, our priorities are really, I think, about how we improve the conditions for social workers to grow the workforce and give social workers more autonomy, increase capacity by improving recruitment and retention, and promote and support workforce wellbeing. Mr. Stewart has touched on all of that, and I'm sure many of you are working in area teams and elsewhere in hospitals or in schools or in wherever you're working are thinking, well, we're quite a long way away from that at the moment. But I think this is about how we aspire, what we aspire to, and how we need to move from where we are just now to where we need to be. And I'll come on at the end into some of the shorter term things we want to do as well. We need, and Alison has been very clear, particularly in our evidence to committee around the NCS, we need to move the profession beyond crisis intervention to also work across earlier intervention and prevention. And Mrs. Stewart just talked about that in terms of the shift away from eligibility criteria, whatever we decide to put in its place. And we want social work education to give social workers the knowledge and skills that they need to be able to practice, and particularly important here is relationship and human rights-based practice, and work with people alongside people. And I know that that's what all of you want, and that's what really social work must be empowered to do if we are going to be successful in this next iteration of social work and social care in Scotland. So how do we get there is the big question, I guess, and that's what we're all working together around. Can I skip on to the next slide? Because actually I've got a duplicate slide. So it's how do we get there and what does the profession need to thrive? I was obviously still not recovered fully from my COVID when I looked at these slides the other day. So I've said a strong and supported workforce through investment in people. So that's about people, that's about having time to develop relationships. And we know the research tells us very clearly that relationships matter. They matter to children, they matter to young people, they matter to adults, and they matter to older people in terms of how we work with people from a strength-based position, recognising the difficulties that people face. That we need to be able to work from the strong ethical value base that social work has already ingrained within it in a human rights, and Mr. Stewart has talked there about anti-racist and anti-discriminatory practice, which we know from the work of SASW are very real issues for us just now. We want to instill some workforce planning. At the moment where I sit in Scottish Government, it feels like there's actually not very much workforce planning goes on around social work and social care workforce, but particularly the social work workforce. And by that, I mean, we need to plan the workforce that we need. We need to work out how we do that based on needs rather than based on budget, which is what happens just now. And that's from the number of social work students we need to come through, the training that they need, and the support that they need to be able to complete that training, through to the support we need to give to newly qualified social workers, right the way through to chief social work officers. And I'll come back to that in terms of some of the work that we have identified that we want to take forward. Manageable workloads goes without saying. We can't have time to spend on relationships if you don't have a manageable workforce, and we know from the setting the bar work that most people do not have manageable workloads at the moment. And that commitment to a manageable workload and relationship-based practice is built in really, both in terms of the independent review of adult social care, but also in the promise. It is something that is assumed, but we are far from it at the moment. We need recognition for social work. I think a lot of times people don't, many others don't really understand what social workers do. They point to the public protection aspects, they point to delayed discharge in hospital, but they don't understand the breadth of what social workers can do and how they can work with others. And a colleague asked earlier, this is very much about how we work with other disciplines, how we work with people in health, how we work with people in education, how we work with people in nurseries, in health visiting, to be able to support individuals and families at the point that they need the support. And we probably do need to be much more explicit about what social work does. So one of the things that we're talking about just now between SASW and Social Work Scotland and OXWA is, what do we want social work to look like so that we can actually promote a better image and a better understanding of social work. And finally there, workforce development and career pathways. We've muddled along in Scotland for quite a long time, both in terms of workforce planning, but also in terms of advanced practice, of understanding what social workers need to be able to develop their practice, what they need to be able to support student social workers and newly qualified social workers, what they need to practice, for example, in child protection and around the Scottish Child Interview model, what they need to practice in terms of mental health officer duties, and a number of other areas where really we've kind of really basically muddled along, and we need to make sense of what's required in the future, both in terms of policy and in terms of how we support people, and have a much more planned and proactive way of doing that. And also on that one, to pay people appropriately. If you spend 4 years doing your social work qualification, another 2 or 3 years as a newly qualified social worker moving into being an experienced social worker, and then you do a mental health officer training course on top of that, which takes you 2 years. And yet, in many places, there is no recognition of both your skills and experience in terms of that, nor the leadership that you can provide to others. So for me, that's a really important point. Can I have the next slide, please? So one of the key, and Mr. Stewart talked about it, key elements of the proposals around the National Care Service is the development of a National Social Work Agency. It isn't on the face of the bill, but it is in the policy memorandum. If you look at that, there is some detail in there around what the National Social Work Agency should do. Now, this is all for consultation and comment, and this is very much what we want to develop together with SASW and Social Work Scotland and our colleagues in the third sector as well. I know SASW covers the third sector, but it's really important that we are talking about social workers wherever they work in Scotland, be that in local authority or be that in the third sector. So the National Social Work Agency objectives are really about how having national coordination around the investment in the profession by providing national leadership, and also raising the profile of social work at a national level, particularly in the political arena around with ministers and with others. And the proposals in the National Social Work Agency cover education, so pre-qualification through to post-qualification improvement. We are proposing to develop a centre of excellence which scales up good practice and allows practitioners to become part of research and good practice, and practice and research need to inform each other as we develop in Scotland. I've talked about workforce planning and training and development, so we would have a national overview of all of that. What I can tell you at the moment is that there are 32 local government employers of social workers. We have 32 different versions of all of this, and then there are many employers in the third sector. So some of whom have actually probably got the best training and development opportunities for their staff. We are also talking about a national approach to terms and conditions, which includes pay and grading. And that is about how do we make sure that we're recognising the job that social workers do across Scotland, that there is some a levelling up and in terms of the payment to do that job, and an understanding of what that job entails, and also addresses the issues in terms of the advanced practice stuff that I talked about earlier. And that's really the proposals that are in the National Social Work Agency, alongside actually having a national agency that looks at practice standards, for example. Can I move on? Thank you. So we are developing these key work strands. These are draft, and Alison and Anne-Marie and Ben Ferrugia and Mike Burns and lots of people from Social Work Scotland and SASW are involved just now in the discussion around, are these the right key work strands? So it'd be good to get your thoughts on the key work strands that we're proposing. So as I said, workforce, national approach to terms and conditions, recruitment and retention, which we know is a massive issue just now. Many authorities really struggling to retain their social workers. We're beginning to see a shift of social workers out of childcare into adult care as well. Some of that's about the adversarial nature of children's panels at the moment. We've heard anecdotally from social workers, but we need to be able to have a proper plan across all of social work and support our social workers to be able to practice. And obviously, we have a continual crisis in the mental health officer workforce. We never have enough mental health officers, and no insult to the mental health officers on this call, but many of them are probably getting to the point where they're thinking about retirement, and that will cause us really big issues in terms of how we support people with mental health problems going forward. On leadership and culture, it's about yes, it's about chief social work officer roles. It's about clarity of the lead for professionals working in whatever system they're working in, whether that's multidisciplinary teams, whether you're working in a children and families area, or whether you're working in adult care or justice. It's about the ability to see that social work leadership, but it's about leadership at all levels. It's about creating a culture that practices anti-racism, that picks up the issues that we know we need to pick up in terms of anti-discriminatory practice, but also it's about how we work with others. So it's not just about chief social work officers, it's about leadership and culture at all levels. And then how we communicate, engage and co-design. I know there's a bit of an aversion to the co-design word in many areas, but there is a real commitment within government to involve the people who work in services alongside the people who use services, and how we design the National Care Service and how we design key elements, and that also extends to the National Social Work Agency. So Alison mentioned the Social Work Policy Panel earlier. They will play a really key role in helping us to shape the National Social Work Agency, but we will be developing an engagement strategy right across social work to involve as many social workers, social work managers, as well as people who use services in the co-design and coordination of the National Social Work Agency. Next slide, thanks. Education and training is really critical. Basically, many areas just now are really struggling to recruit and retain their social workers. We're just about training enough social workers to fill vacancies at the moment, but that doesn't relate to need, and it doesn't relate to how we need to work as we move forward. We have had through the pandemic a fairly strong social work education partnership with the HEIs who teach the undergraduate and postgraduate courses, but it needs more teeth. And we need to be able to provide our students with the right kind of support to be able to do the training, with the right kind of placements, so that when they come to work alongside colleagues, they've got the experience that they need. And we need employers to cooperate with that, and not to be borrowing and begging people for placements, which is the reality at the moment. So we are looking at how we develop the support and the infrastructure around students, around placements. In the new year, we will also publish an advanced practice framework for consultation, which will look at what we need our social workers to do in terms of qualifications and advanced learning. I've also already mentioned the Centre of Excellence, and a key thing I wanted to mention here was the trauma implementation support. We're looking at how we develop that trauma implementation support in the short term, so that we embed that trauma-informed approach across our workforce. And on quality and improvement, I think there's quite a lot to do here. Many of the improvement resources have been stripped out from the frontline. I see Dee is actually on this call, who's from IRIS, the Chief Executive of IRIS. One of the resources we do have left that helps us in terms of improvement, but we really need to embed that improvement resource at the front line. That relates to the Centre of Excellence, so that we have social workers who can also contribute to the research and practice development agenda. But I think there's a time now for us to consider how we set practice standards and how we monitor those practice standards, as well as improvement, and how we develop the role and profile of social work so that others understand what we do as well as we understand what we do. Thank you. Next slide. So, a word. All of that was about the National Social Work Agency. It's a work in progress, and we really need to hear from you what you want to see in there. But we're not sitting around doing nothing waiting for the National Social Work Agency. Excuse me, sorry. Just recovering from COVID and still have that cough. We have, as I said earlier, worked really hard around the social work education partnership, but we really need to move now, and we're beginning to put new resources in place around creating a regional infrastructure to support student placements. We've set up there's been a national resilience group been set up with Social Work Scotland involved, looking at the current crisis that we have in terms of social work recruitment and retention, looking at how we can use the resources we've got better, and looking at any ideas that people can bring forward to address the issues that we currently have. So we're considering, for example, developing a graduate apprenticeship for social work, which would see people employed, perhaps as social work assistants, and given the opportunity to train as social workers, and then to go on and work in the authorities that they are training in. And we're looking at the best way to roll out the newly qualified social work supports. We've seen instances, sadly, where newly qualified social workers have been put in really difficult situations, and we don't want that to happen again. And we need to think about how we support our social workers so that they stay in and then go on and progress and become even more qualified in the future. And as I said already, the Advanced Practice Framework will be out for consultation early in the new year. The trauma-informed practice, we have got money now to develop, to put in place a team led by Kirsty Pate, who many of you will know from Edinburgh, who's a real expert in the trauma-informed practice, which basically looks at a team which will help to develop the trauma-informed practice across social work. So from undergraduate through to practicing social workers through to advanced practice. And I think the problem at the moment is much of what's been offered to social workers has not been at the right level, and Kirsty's been doing a huge amount of work. So that team, we are out to recruitment just now. I think I was trying to advertise, if any of you are interested in trauma and you want to work with us, we've got jobs. But it's really important that we begin to actually implement a lot of this now, not wait for the National Social Work Agency. And I would look forward to any further suggestions that people have of things we can do now. Thanks very much, Alison.
Thanks very much, Iona. There's a few comments coming through in chat, but what we're going to do is we're going to run through the next couple of speakers and come back to kind of a more panelly chat at the end. So thank you very much. And yes, yes, the COVID brain isn't showing at all, which is well done, because it took me about 4 months before I could sort of say more than 2 sentences in a row. Thank you, and we'll move on to Deyna Mehrdad, who is the Deputy Chief Executive of the Multicultural Family Base. And Deyna, you're going to talk today about protecting people's rights against racial prejudice. Welcome.
Thank you, Alison. Hi, everyone. As Alison said, I am the Deputy Chief Executive at Multicultural Family Base. For those of you that don't know, Multicultural Family Base is a third sector social work organisation that supports BAME children and families. On the back of our work alongside SASW, I'm happy to have been asked to speak today to give some input on the issue of racism, though I want to say that none of this is new, and that while I'm happy to be here, I don't claim to come with any new concepts, and I am sad that this sort of input is still required so significantly. Before we get into it, I just want to start off with a couple of notes and saying that when I was asked to speak today, my first thought was, how on earth am I going to cover such a huge topic in 20 minutes? I then thought, how am I going to talk about protecting people's rights against racial prejudice when so many people don't actually know what that means, despite the misguided sense that we do? So in place of that, I'm going to cover some wider concepts about racism in Scotland, and my hope from this input is not to rant or lecture or death by statistics, but instead to spark thinking. And those of you unfamiliar with the concepts I'll cover, and for those of you who are familiar, this might serve as an opening for us to work together, whether directly or in a broader sense. Sorry, I'm looking at the notes coming up. My details will be shared, and I'm more than happy to follow up with anyone that has any questions or input following the speech. I'll also point out at this stage that I don't claim to be an expert. I am one person who happens to have personal and professional experience of racism, who hopes to share some of this with you today, and that's an important point that I'll revisit later on. Last point on this slide before we move on is in relation to terminology. I'm sure that you're all aware there's so much terminology available to us, and it can be overwhelming, and it often gets us into trouble when we don't get it right. It's very unlikely that there'll ever be phrases or terms that fit everyone, but for the purpose of this speech, I will interchangeably use the terms Black with a capital B and BAME, which is Black, Asian and minority ethnic. Can I come to the next slide, please? Oh, sorry, the next slide after that, Sarah, I skipped one. Thank you. So this slide asks the question about whether racism exists in Scotland, and to begin answering that, I'm going to refer back to the title of my speech and tell you a little bit about myself. So the story of the title of the slide, sorry, is Do You Have a British GP? And the story to that is that during the pandemic, I had hurt my shoulder and had to go to the accident and emergency room. And I'd called ahead, and when I arrived, was sat in the waiting room before my name was called out, incorrectly might add, but that's another story. And when I got to the reception desk, before I even got a chance to speak, the receptionist got up off her chair, leaned forward and very loudly and slowly asked me, do you have a British GP? Now, my partner at the time, who is also Scottish, was of course perplexed, because in his eyes, I am every bit as Scottish as he is, with the exception of my food choices, as he loves to point out. But for me, this was one of thousands of experiences of unconscious bias or microaggressive racism. And of course, not forgetting the good old, where are you really from, or how long have you been here? Are you the interpreter, or you're very welcome here? Now, my point in sharing this example is to set the context for racism in Scotland, because we are a country that prides itself on being inclusive. We're one big tent, we're welcoming of everyone. And in comparison to the likes of America, parts of England and other parts of the world, we are perceived to have lower hate crime statistics specific to race. We've got fantastic legislation, and we've got so many equality groups and forums. So on paper, it's actually very difficult to make the case for Scotland being a racist country. Now, this is really important, again, because we often think about racism in the context of what we see in the media. And that is stories like Stephen Lawrence, Sheku Bayo, George Floyd. And as a result, we contribute to the long-term and adverse experiences of our population. Now, because of that, there's this notion that you need to use your trauma in order to be able to justify a racist experience. And I hear, and I've heard it today again, I hear the need to have lived experiences at the forefront, but this is only helpful if it's acted on rather than logged and reported for what feels like the millionth time, yet we're still here and talking about the same issues. So I'm just going to get this bit out the way and say it, that just because you might not see it, it doesn't mean it doesn't exist. I am sad to say that despite years and years of effort, that racism is very much still alive. And in Scotland, because it's subtle or covert, it makes it even harder to challenge. We only have to look at Scotland's recent response to Ukrainian refugees in comparison to the response of the Afghani and Syrian refugees to know that there is something still not quite right. If we can go to the next slide, please. Now, in this conversation, it's really important for us to consider intention versus impact. The impact exists regardless of intention, but knowing the intention will dictate our response and ultimately dictate whether we can make a change, whether we need to do something more, or whether we need to cut our losses and move on. Now, there's something to be said for the sins of our fathers. Scotland does a really poor job of educating our children on Scotland's own role in the history of racism. I don't know how many of you are aware that Scotland was one of the European countries who benefited most during slavery, or that it was Scottish immigrants that actually started the KKK. Now, the idea of me saying this is not to dredge up the past, but if there's no transparency and accountability for this, we've got no real chance of eradicating racism, certainly not in any of our lifetimes. It also goes some way in the continued alienation or exclusion of Black children who are going through the education system, either not seeing themselves represented, and when they do, it's not a full account of history, so it makes them feel even more displaced. Now, when I hear the term, or a similar term to why should I pay for the sins of my father, or this sort of stuff is historical, it astounds me given that so little is taught about it, because more than that, it speaks to intention. Without that understanding of the past about ourselves and our country, our intentions are likely unclear, and therefore the impact is unpredictable. This is not about blame, and it's more than taking accountability. The notion that we shouldn't pay for the sins of our father furthers the idea or the belief that we have no responsibility now, and we absolutely do. Another really important area of thinking is power differentials and what role they play in intention and impact. Now, this is a huge topic on its own, and it stretches well beyond racism, but in a nutshell, power differentials dictate all of our interactions because someone in any interaction will be perceived to have more power or authority than the other. And without acknowledgement of this, again, intention becomes ambiguous. And with that, there is likely to be a detrimental impact. So we need to know how to approach and respond. I'll give you an example that I am a practice educator. So I'll use an example of my early practice education days where I had a white student. And the white student grew up in a really small town where diversity was really lacking. And during those first few supervisions, the student was constantly questioning my education, questioning how long I had been qualified and what was my experience, and so ultimately questioning my ability as a practice educator. Now, it came out later that this was purely on the basis that they had never seen a person perceived to have power, in this case as their assessor, who was not white. The intention there was not to be racist, but that is how it landed. Now, without us having explored our profiles and acknowledging those power differentials, this could have had a very different outcome. So you can see the importance of establishing intention, because if I thought that this was a direct attempt at being racist, my response might not have been to focus on reflection or education, but instead to assess risk, particularly as this was a social work student who would ultimately be supporting Black service users whilst on their social work placement. And that brings me nicely into my next point, that racism is a social construct. You all have heard the term that no one is born racist, and that is very true. But we know historically that racism is rooted in the notion that biological differences in some races meant being inferior to another. One that we still hear about today is that Black people without the capital B can't swim because their skin doesn't allow them to float. Now, again, there's an array of literature that highlights the importance of differentiating between race, ethnicity, and culture, but we don't have time for that today, so I'm focusing on the fundamental ideas here. Science has proven that humans are humans, and whilst various other factors like health and environment and social setting will have an impact on adverse experiences, ultimately, as far as human bodies go, no one race is biologically superior. And yet racism remains because it is in fact a social construct, one that's been developed for far longer than most of us in this room have been alive by our various societies. And in a lot of ways, what we need to do is unlearn this social construct. Now, this is important to note when thinking about intention and impact, because it's a further example of the importance of knowing where people are coming from so that we can ascertain an appropriate response and approach. i.e. whether there is a genuine lack of knowledge or understanding that requires education, or whether the knowledge and education is there and racism prevails anyway. And where that lands us is what we see a lot of in Scotland, and that is institutional racism, another huge topic. The term itself covers a vast amount of territory, both literally and socially. And when I'm referencing it today, I'm speaking to both. That is the actual systems that exist in Scotland, as well as the social groups that inhabit them. Now, this is an extremely important area in relation to intent and impact, because oftentimes, regardless of the intention of an individual, the systems that exist are inherently racist. I'm going to keep this very simple without making it a lecture on theoretical concepts. So instead, I'm going to give you some really tangible examples from my direct professional experience. I've been invited along to many child planning meetings where the family have little to no English, and an interpreter, for whatever reason, was unavailable or late, and education staff wanted to proceed anyway. I've been to many housing appointments where families have been asked to bid for houses using that Ed Index system, but given absolutely no support to do so or have the access to the technology needed. I've had to log on to that god-awful Universal Credit Gateway website more times than I can count, because sending a leaflet, even when it is translated, doesn't help someone who is newly arrived to the country and already experienced trauma and change and transition to navigate it. In my social work experience, I've advocated countless times for families where the relationship has broken down with universal services because there's no understanding of cultural differences. We'll speak a little bit about that later. For a time, this was an area of specialty for me when I was working a lot within the Roma Romanian community, where a lack of willingness from universal services to understand the cultural and social journeys of these families often resulted in child protection issues, where they otherwise could have been avoided if there was more of a cultural understanding. Again, the last example is thinking about Scotland's recent response to Ukrainian refugees, which is another significant example of institutional racism, where there was a clear and stark contrast in how we responded to Ukrainian refugees in comparison to how we responded to the Afghani and Syrian refugees. Now, as a result, regardless of intention, in most of these instances, the impact is that of a detrimental one, and that's that people suffer. Whether they don't get paid or can't pay bills or lose their housing priority, or that the kids are removed from the care of their families, the impact exists regardless of intention. It lands somewhere, and sometimes the impact is a long-term one and sometimes it's a short-term one. And I guess in summarising these massive areas, the message that I want you to hear is that establishing intention is indeed important. It doesn't erase impact, but it does, however, open the door to us being able to support one another as humans from a place of understanding rather than a place of defence or attack, which puts us in much better stead to tackle racism. If I could have the next slide, please. Now, I hope that when you read the programme, no one expected to have a step-by-step guide on how to be anti-racist after this speech, because I cannot offer that. Instead, what I can offer are some considerations. Firstly, to consider the concept of intersectionality, and I'm going to be really careful in keeping this very brief, but I will reference it a little bit later on. I also really encourage you to explore this concept further if you're not familiar with it. As a social worker, like many of you, it comes very naturally for me to think holistically and to know that racism does not exist on its own. So our response and approach to racism cannot only focus on race. I also wanted to briefly speak about the terms white and white privilege, because they have a significant bearing on the conversations around racism. So I'll start by saying that white and white privilege are not dirty words. To be white doesn't mean that you're a bad person and personally responsible for racism. And to have white privilege does not mean that you've had an easy life. I often hear white people ask, tell me how my whiteness has privileged my life because I struggle with X, Y, and Z. And I guess the answer to that is firstly that it's not a competition on whose suffering is worse. We all suffer as humans, and the world has a way to go in tackling oppression and discrimination beyond race. But what it does mean is that whatever discrimination or adverse experience you've faced has not been because you're white. White privilege is something I'm asked to explain almost on a daily basis. And when I'm asked the question, I often respond with a question. And the question is, do you have to consider your skin colour on a daily basis? And the answer is no. And that is the difference. Again, we need to consider intersectionality here because we are all likely privileged in some way. Most of us in this room have an education, for example. Being able to speak English or having a home or a job are all instances of privilege to some extent. And the reason I highlight these terms is because they often result in defensive behaviours, and it puts a barrier in place of what should be us learning about each other. I really want to change that narrative. Facts are facts, this is true, but I want to unlearn the construct that is ever more apparent that these are dirty words and rid them of the negative connotations that are connected to them. Now, another note of interest in this slide is cultural competence. Now, as I said, there's a lot of literature about racism, racialism, and cultural racism. But in simple terms, to be culturally competent does not mean that you need to be an expert on every culture that exists in the world. It means that you understand that there are differences, your own included, and that you know that these differences will have an impact on how we experience life. And finally, for this slide, I want to very briefly talk about equality, because that's a term every person in this room is familiar with, yet there still seems to be such a lack of it, certainly from my own professional experience. The most important message that I can share in this regard is that equality is proportionate. That is that unless we all have the same starting point, simply providing what is perceived as equal opportunity is not enough, and ultimately becomes a checkbox exercise. It actually results in further discrimination and oppression. Ultimately, there is no equal opportunity without equal capacity. So, for example, far too often, especially recently, I hear about plans to get Black people into positions of leaderships because we know that Black people are underrepresented and that inequality and racism is what prevents this from happening. Yet there are no considerations, or I've not heard any considerations beyond what feels like nothing more than positive discrimination. This idea that if we get enough brown faces in the right places, but with little consideration as to what their experiences will be like when they actually get there, because the systems are still broken. More often than that, I often hear about building the capacity of BAME people. If they are better, they'll be more successful, and it really puts the emphasis on them to work harder, only then again to be put into a system that is inherently broken, rendering all that extra work useless and unfair. And finally, I hear the term, I don't see colour, far too often. And again, I'm conscious of intention here, because I don't doubt that people are well intentioned with this statement, but to not see colour has the opposite effect. It undermines the experiences of Black people who do experience life differently on a day-to-day basis because of their colour. And it ignores the additional barriers faced every day because of this, and actually is a really good example of inequality. Can you take me to my next slide, please? So in the end, where does this leave us? During the pandemic, the death of George Floyd saw hope return through the resurgence of the Black Lives Matter movement. People stood up and they rallied and they campaigned, but this seems to have died down the same way it did after the death of Sheikh Obayo here in Scotland. Now, taking into account intersectionality, we can all acknowledge that times are tough for everyone at the moment. It's been touched on today. And we only need to think about the narrative in our own media following the reign of Trump and Johnston, where the world was essentially told it was okay to hate. And what we're left with is the impact of that. The way that anti-immigration political views are essentially condoning racism. I only recently returned to listening to the radio because I boycotted it during the pandemic, but I was appalled and angry and upset to hear people being thanked for their calls to radio stations, which mostly consisted of terms like those bloody foreigners and we should be looking after our own. So my parting words, I guess, are that we are all humans and we're in this together. It's important that we stick together and support one another. With so much else happening in the world, that essentially means that we all have a responsibility to eradicate racism. And I hope I've highlighted that it is very much prevalent, just not perhaps in the way that many of us think about racism, though that does exist too. So I'd encourage you to take responsibility for your own part in that. That means not looking to your Black colleague or friend or neighbour or service user to advise you on all matters relating to racism or race. That means having a willingness to learn and recognise what you don't know and then find a way to get to know it. That means challenging racism when you see it, whether it be a person or a system. It means to be considerate and curious, even when we live in a time where there's a real fear around getting it wrong. It means a commitment to know yourself and how your own value and belief systems will impact your own interactions, specifically in relation to racism. And it means leaving your comfort zone and accepting that your role as a fellow and accepting your role as a fellow human. Because without all of that, I'm a very firm believer in that if you are not changing, you are choosing. So again, thank you all for listening. And as I said, my details will be shared if anyone has any questions or follow-ups.
So much, Deyna. You can see there's quite a round of what we call it, remote applause happening there. I feel if people wanted to clap online, and we'll certainly do that nearer the end maybe. But a lot of support. That was really powerful. And as you say, that kind of our responsibility for unlearning the constructs that we've absorbed, for taking responsibility, for self-critique, and to act and change. We're going to have to move on quickly because I've chaired this slightly badly today. My apologies. We're 10 minutes over. So John, I see you've got quite a lot of slides, and I'm just wondering whether you can use your time, maybe cut down a little bit. So there's a few minutes of questions at the end would be really great if you can choose your best slides. Thanks very much. Over to John, who is the General Secretary of the Social Workers Union.
Alison, I'm a seasoned pro, and being last, I'm well used to things overrunning, so no problem at all. I think I won the award for the snappiest title today. So if you put that back to the one before then, you can see that the title was addressing the challenges of recruitment and retention, caseload burden, parity of esteem, developing the profession. There you go. I've just won that award. So the next slide, as you see, I'm John McGowan, General Secretary. I'm also the practice tutor for the Open University, and I'm still a registered social worker and proud of that, having just been re-registered again. So I bring that to this talk. So what I'm going to try cover, I'm going to try give you an overview of some of the research that's been going on, and also I want to cover some other aspects of the presentation. So if I look at the working conditions, then I'm looking at recruitment and retention. I'm going to try go through this quickly, but I'm happy to clarify things later on if I can. If you look at recruitment and retention, I'll be reflecting on some of the findings of the Miller and Barry report for Social Work Scotland. And if you think of that report that highlighted the heavy toll experienced by social workers in Scotland, that included unmanageable caseloads, little career progression, no structured personal development, unpaid overtime, and excessive paperwork. So I'm going to combine that with some of the research that our union done along with BASW. I'll touch on that later on. So if you look at working conditions, what do I mean by working conditions? Well, there's really four big strands of working conditions. There's the demands, and that's about how much work we do as a social worker. So there's the quantitative part of that. That's about the amount of work we do as social workers. And there's the qualitative part, and that's got to do with the complexity of the work. There's also the control. So another part of working conditions, the control, how much control you have as a social worker over the job, including the pace of job, the allocation, and the decision making. There's also peer support that comes under working conditions, and that's about the amount of support you're offered by your peers and colleagues, and also relationships within the team. And another aspect was the worrying increase in caseloads. It's a difficult one, caseloads, because caseloads mean so much to so many different people, but really the increase in caseloads, it wasn't the number, it was the complexity I'll touch on. So really the high level cases and the over allocation of really high risk cases is on the increase. There's also a large percentage of social workers looking to change career, and we'll come to that later on. And there's also limited focus on qualified permanent members of staff and the overuse of agency staff. Agency staff do a wonderful job, but it shouldn't be seen as a long-term option to fill a gap. It should be used as a short-term resource. So next slide, please. So the next slide then, some of the key points from the research I'm going to touch on, and also from setting the bar, was that social workers, and this is quite useful because we've heard all the promises now. I've been around a long time, and I do spend a lot of time in Westminster, and I'm used to so many promises from politicians. So let's hope that it'll all be acted on, and we can get the answers to these points I'm going to raise. So social workers work on average 11 extra hours per week. In the research, social workers have to work while ill to clear the workload, and the fancy academic term for that is presenteeism. So that's that feeling, and I think we can all relate to that, the feeling where you're not that well, you're off work, but you're thinking, if I don't go into work, then my caseload or my reports, they'll still be waiting for me. So there's a real aspect that social workers going into work while they're ill, just to clear the workload. There's a lack of proper supervision within social work. And I've just finished a research paper that's published next month in the British Journal of Social Workers, along with a few other academics. And we're exploring what is social work supervision, how does it look? And we've just got free access for that. So please do look out for that. I'm sure SASW will share that from the next journal. And again, social work managers not having adequate training. Social work managers in my social work career do a magnificent job, but managers need support for the job that they do. And in my experience, managers are going up the ladder very, very quickly, but they're not getting the right training to understand the complexities of managing a team. So we'll move on to the next slide, please. Just to tell you a bit about our survey. It was the biggest survey in the UK regarding social work, and it covered the period of 2017, 2019 and 2022. And the survey, there was consisting of a number of separate questionnaires that was sent to all our members, and also SASW and BASW and SWU, and we looked at working conditions, we looked at outcome measures, and we looked at demographics. And so we covered that. So that was a survey in 2017, 19, 22. And now you're going to ask me, what does that look like over these 5 years, John? And the next slide, I'm going to try to show you some of that. So the next slide. So what we found over the 5 years, and again, it's reflected if you even look at the BAR report, and I think some of the key stats from that is that 78% of Scotland social workers said high admin workload was the least satisfying part of the work, and that was followed by the lack of time for any preventative work, and obviously the high caseloads. So if you look at some of the stats over the 5 years, don't get caught up too much in the bar charts, but really for comparison, you can see between the research in 17 and 2022, if you look at demands, there's not a lot changed. So despite all the promises over the years about things will get better, over that 5 year period, that in any way you could argue that the demands on social workers have increased. Similarly, what control you have in your workplace, what control you have with allocation, again, it's slightly increased over the 5 years. I'm sorry for sharing all these happy facts with you, but it's got to be done. The managerial support is probably quite similar. Peer support probably quite similar over the 5 years. The relationships within a team slightly better, and your role and the ability to change your role is probably the same. So I guess if you want a summary, what I'm saying is that over the 5 years, there's not been a big lot of changes in social work. And I think overall our survey covered, I think it was getting close to 8,000 respondents. So it's a fair, adequate representation, I would argue. So the next slide. So the next slide I want to look at is the satisfaction, the migration and the attrition of social workers. And you can see again, if you look at the comparisons between 2017 to 2022, that in 2017, 40% of respondents said that they were dissatisfied with the present state of social work and the working conditions. Compare that to 2022, you can see that's risen quite significantly to over 50%. And again, if you look at the migration being it for social workers looking to maybe change jobs within social work, the migration again has increased up to almost 60% of respondents saying that they want to migrate from the present role. And if you look at attrition, and attrition being when social workers want to leave the profession altogether, start a new job. And I can think of a good friend of mine who's recently passed his taxi driver test. He's a social worker and he's now going to be driving. I think he'll make a really good taxi driver, but he's actually want to leave the profession. So you can see that there's a number of social workers who've just had enough. And again, that the figure from 2022 is around 35%, we guess, is just wanting to get out of the profession. So if you look at the next slide, I mean, particularly want to look at stress, you can see that, I mean, stress is just, overall stress is not a negative, it's always there, but it's how you manage that stress and the amount of stress. But we can see between 2017 research and 2022, the level has just increased. and it's probably the worst that we've ever reported on before. And there's another paper that we've completed on stress, but just as a comparison, I would argue over 5 years, the stress on social workers have increased. The complexity of the work and the working conditions has contributed to that factor and the demands on the job. So if we go to the next slide, so just some of the qualitative responses regarding the sources of stress. Now, we asked individuals to comment on just aspects of the stress, what was causing the stress, and surprise, surprise, number one was caseloads. So the social workers who had responded identified that what they were looking for traditionally was lower caseloads, really, but not just lower caseloads, but caseloads that would allow social workers to provide a more person-centred approach. That old chestnut that I think we all got into social work to promote change, but it's difficult to promote change if you're just firefighting all the time. So social workers were looking for lower caseloads, the opportunity to build relationships, and an opportunity to have time to properly listen and support the very people we work with. So that was high on the list. Secondly, again, reflecting on my 25-year career in social work, in previous years, social workers have had a good third sector organisations to refer to. We've had good other statutory clubs, but all the funding from central government seems to be cut. And although there are some good organisations, they're far and few between. So social workers commented on the lack of suitable resources, and the argument being that we're looking for better funding for other organisations to enable us to refer to. Again, the workload, paperwork. I think we all know the multiple paperwork that we complete as social workers, sometimes for different audiences. So you could be writing the same report for perhaps child protection, for education, for safeguard, and the list goes on, where we really need to streamline the amount of paperwork that social workers are doing. And again, it's something that I think Iona touched on, was respect for the profession, that, it's very easy to, to trod on social workers. But part of that is that as a profession, we've never been very good at saying all the wonderful things we do. And I think we need more opportunities in the media to reflect that, enable that, we've promoted so much change, we've made differences in so many people's lives, but we don't often get a chance to tell that tale. And we are doing some work at the moment between BASW and SWU. We're working with the media regulators at the moment to, to highlight to stop the negativity around social work. So please do watch that space. So again, some of the qualitative responses, you can see the following. And if we go to the next slide, Alison, again, looking at these responses, we asked our members, joint members, including SASW and SWU, well, how do you improve your well-being? And again, by analysing the responses, the indicators have been that looking for peer support, family support, more rest at home, so more individual time, managerial support, and flexible working. I mean, flexible working is getting there, and if anything's been positive around COVID, if we can say that this ability to be able to work at home and blended, but there's a long way to go. And again, one of the campaigns I've been working on is promoting the part-time work. I think that women are misplaced in the social work community. There's not that many opportunities to work part-time. And the recent research we completed, Scotland was actually higher from the nations. There was several part-time opportunities, but it could get better in the workplace to work around the needs of families and people's lifestyles. So we're looking at the next slide. Sorry for going through this, but I'm aware of the time. We're looking at the workplace stress. Just a stat for you that basically it's costing £800 per employee when people are off ill. I won't go into that too much details because of the time, but I'll look at the next slide. So just over 2021, we spent part of the survey actually, and again, we spent 50 interviews, 4 focus groups, how to develop the profession. And again, much of what I've said before, some of the answers were workload, managerial support, supervisory support, and changing the social work culture. And again, that social workers have too many cases, the levels of stress, poor working conditions. And again, it can take up to 5 years if you think of pre-qualifying. And it's not a good result if folk are then leaving the profession quickly. And I think the average is 7 years in the UK at the moment. So after you qualify, you're burnt out by about 7 years, which is not good value, really. So over the past 5 years, working conditions have not improved. Social workers spending just about 20% of the time with the caseloads, and there's little or no time for reflective practice. Again, on a positive, we all love our job, and it's, there's aspects of our jobs that we love, and this is why we got into social work. But there's too much expected of you as a social worker with too few resources, and again, the underfunding. So let's hopefully that will be challenged a bit more in Scotland with more resources. And again, if you get the slides, BASW and SWU, we put some resources into a toolkit. And if you've not seen the toolkit, you can download it on the URL link. And it doesn't look like that. I think Claire in the community just tripped over it, but it's a lovely toolkit, and it's got lots of good ideas, and even to bring them to supervision, so you can speak to your supervisor about well-being and other aspects. So the wider solutions, I would say that social workers need positive professional working conditions, reduced stress, and proper training for managers. I would always argue join a trade union and a professional association. You get 2 for 1 with SASW and SWU if you sign up to our union. Create good opportunities for professional development, have time for reflective supervision, have a manageable caseload, and reverse the blame culture and give social workers the support. And I think I forgot to tell you to move on the slides, Alison. So if you keep on moving the slides, that's the next one. Next one. Next one. That's the one. So that's the one. You heard me talking about Claire in the community. You must be thinking, what was he talking about? But that was Claire in the community there with the URL link. So you can copy that. And the next slide, the parity of esteem, I've covered that. And the next one. And the next slide. That's it. So then the wider solutions, and that's it. So that's everything. So thanks for listening. Sorry for the rushed presentation, but please do look at the slides. Thank you.
Wow, thank you, John, for a whistle-stop tour on just so many things. And if you're able to bung us a link to your blog and things, that we can also put that in the chat, where people can find some of those discussions that you have on a regular basis, outward facing. And again, more applause coming for you there. Thank you. There are a few kind of, if people are okay to stay on, I realise we've got 3 minutes. Would people like to stay on just for a few more minutes and have 1 or 2 questions? I see that there has been stuff in the chat. So since John's on, Catherine Lindsay asks, how can the unique perspective of social work inform Scottish decision-making negotiations on paying conditions? And I guess maybe this is a bit for you and Iona in terms of what the links are.
Yeah, well, again, the aspect of pay conditions, I would argue, it's antiquated. So if you think of the big unions who dominate social work, my view would be that what have the big unions ever achieved for social work over the last 20 years? So, my view would be that I think that paying conditions needs to embrace some specialist unions like ourselves, and not to block unions like the Social Workers Union from negotiations. So that's my view. I think if we were part of that discussion, then you would have a positive result, and you can see the difference that our union has made over the last 10 years. And maybe that's why our membership continues to grow in a mass way. So that's my view. So thank you.
Iona, do you want to come in?
Yeah, I'm thinking how to follow that. But I guess, I mean, I think there's a lot of different views about this issue, but I do think it's an important issue in terms of what's happening just now in some areas, particularly smaller areas, really struggling to keep up with the larger areas. And it's not just about pay. I think what John said there is about the whole, it's about the whole package, basically. And we were just talking this morning about actually the areas that seem to be the best are they do pay better, but they also provide their staff with better training and learning and development and better support and more visible, quite often more visible social work leadership. So I think it's about the whole package, and what we really want to explore here is how do we bring the whole country to the same position, so we can stop robbing Peter to pay Paul, basically. But also, how do we pick up those wider issues around support for improvement, support for training and development, recognition when you do that, and the support and supervision, be that whatever form of supervision that's built in ability to reflect on practice. So it's the whole package, really.
Thanks, Iona. I can see Linda's got a hand up. Linda, would you like to ask a quick question?
Yes, I'll try and be very quick, thank you. In thinking and listening to a lot of different situations where I can get a hold on the problems that social workers have, one of them that seems to spring up a lot is the fact that COSLA and local authorities don't always seem to appreciate the profession of social work, that social workers do actually know what they're doing and have been out there and seen what the problems are. And are suddenly having to come back and everything's great until they start to face, well, we need this, can we have it? And then COSLA is turning around and saying, no, we can't fund that, we haven't enough money, we don't want to do that. That must be very, very difficult for social workers, and to have to go and then be turned down all the time. It seems there is more need for people like COSLA and members of the local authority to actually have, shall we say, a better communication with social workers, so that not just the social workers are educated in the needs out there, but the ones that are basically holding the purse strings and not wanting to let go.
Any thoughts from the speakers today?
I've just got a quick point, and that's an excellent point you make, because we're working to a system that is very antiquated, and the voice of social workers, I think, have been lost in that story. And I think if you look at looking at these stats I provided over the last 5 years, you can see that there's not been any changes. And if you develop the voice of social work within that mix, and that's why I'm very pleased that SASW is working closely with Social Work Scotland and the Scottish Government, because I think it's important to reflect the voices of the social workers who are doing the job, because in a way, social workers haven't got the time to engage in so many forums, so they need somebody to represent that voice. And I can assure you that our duty desk is full every day of calls from social workers struggling, and I suppose they can't see the long-term option, so there needs to be a process to enable that voice. So I'm pleased that discussions are happening behind the scenes, and hopefully someone will listen.
Anybody else like to come in?
Alison, it's Iona. I mean, I think there is a real tension here between how local areas want to approach this and how and what the solutions are. And I do think that the time has come for a national approach. We're not a big country, Scotland, and I think that we really need, if we are seriously going to tackle the recruitment retention issue and improve services, improve the way that people's experience of working in them, and improve the experience of being involved in services, then we do need to take this national approach. So it's a point of discussion between ourselves and COSLA.
And there's probably one just final point, sorry, just want to get through that. I suppose we're in a fortunate position because we've not got characters like Josh McAllister and frontline running social work, that at the end of the day that we're in a better position in Scotland, that we still we can still advocate for the voice rather than using the private sector and experience practitioners representing our profession.
I think what we're hearing from everybody is the importance of having that direct link to people who are doing social work, people who are experiencing and need services. And I guess that kind of all wraps up into the approach, both for the National Social Work Agency, the National Care Service, but what we do in the meantime. I'm aware we have completely run out of time for questions. Deyna, I can see you've made connections with people in the chat, so I'm really glad about that. I think part of that's what we always want to get in some kind of in a conference event is people making connections with common interests, common themes, and going away and learning from each other. Thank you all so much to our speakers today. We've got 3 sessions tomorrow on learning disabilities and relationships, on addictions and rights, and on poverty and the impact of that on people who need services. You'll get the joining links for the sessions. One will go out this evening, and the others will go out 2 hours before each session. We hope to see you there. We're not having the SASW social as we were hoping to. But if any of you are in Edinburgh tomorrow, do come and meet us. We've got a table at Brewhemia just behind the Waverley station, and if any of you are around,